There was a rough timeline that was released, or a rough plan released by the federal government coming out of the CDC, and they've got stages 1, 2, and 3. And we are in stage 1A, which was described as healthcare workers, starting with frontline staff, ER and ICU staff specifically, progressing more broadly to all healthcare providers, to include dentists and mental health crisis workers and optometrists and the like. Simultaneously, as part of 1A, residents and staff at long-term care facilities are included in that. Hospitals, at least here in Vermont, are responsible for the healthcare staff. The long-term care facilities is on a separate and independent track that was contracted with large pharmacies, CVS, Walgreens, things like that. And so even though Gifford owns a retirement community and nursing home, we're not actually vaccinating them. A pharmacy is. After that, there is phase 1B, and this is where things start to get somewhat muddy because there's much debate over who is included in 1B. In general, it is essential workers. That would include police, fire, grocery store workers, etc. And then there is some question about whether or not people over age 75 will be included in that. The CDC includes that right now, although ultimately how that goes will be determined by the state and the Department of Health. The individual hospital systems have been left to manage their health service areas, and so the speed at which this occurs is kind of dependent on how big the task is for a hospital system. Gifford is moving along pretty well, and we anticipate getting to phase 1B probably mid-January, but we'll see. And of course we have to do what we're told by the state. And then once we get through phase 1B, 1C has been roughly described as vulnerable adults and adults over age 65. So if you're high risk for coronavirus for some reason, chronic disease or what have you, you would be included in that category. And then that will be sometime after we are nearing the end of phase 1B with the essential workers and potentially adults over age 75. A lot of this is very difficult to pinpoint timelines because we find out things frequently just a moment before it's supposed to happen. Our clinic last week on Wednesday, we were asked by the state to do it on Tuesday. And so despite our protests that we weren't quite ready, they managed to convince us, and we put it together. The timing of the vaccine is going to be uncertain. And that's largely a product of that this is a new vaccine, and so there's not been opportunity to measure the duration of effect. So we know that it is an incredibly efficacious vaccine. There have been studies that have shown that antibody titers in patients that receive the vaccine are very, very high, and even much higher than people that have actually had COVID. So it is a great vaccine, and it works really well. It would be reasonable to expect that it will have a long-acting effect based on that, but I can't say that for certain. I would guess this is going to last a long time, but I don't know that. And then there's also the question of how fast is coronavirus going to mutate? And even if the effect is long-lasting, if we're looking at a different virus, say next year, sort of like influenza, you might need a new vaccine to deal with whatever seasonal um, round of coronavirus we see. Um, or it may be that a large percentage of the population gets vaccinated. It's a really efficacious vaccine. We achieve some degree of herd immunity, and coronavirus kind of dissipates from the general milieu. At least here in Vermont, I expect us to see benefits relatively soon, within a few months. Um, we're not going to achieve herd immunity that fast. There's even speculation that we'll run into what's called the vaccine cliff. Right now, through Pfizer and Moderna, the federal government has contracted essentially to vaccinate 100 million American citizens. There are about 350 million Americans, and so we will run out. It is possible that the Johnson & Johnson vaccine will come through and pick up that slack, but if not, the manufacturing capacity for Pfizer, we're not going to likely receive more until late June or July. So that's a problem. However, the big concern that everyone has had from a public health standpoint is that hospitals are going to be overwhelmed and that there's going to be a lot of unnecessary deaths. It's very clear that the sicker people and the deaths are largely limited to older and vulnerable adults. Kids don't tend to have a problem with this. It's possible, but it's very rare. Young adults don't tend to have a problem with this. If you're over 65 or 75, that's when we run into trouble. Such that if we can vaccinate the bulk of vulnerable adults, then you're going to start to see death rates fall, and you're going to start to see hospitalizations fall, even if total infections are not going to fall. And so if we've accomplished the things that we need to accomplish in terms of protecting hospitals from being overflowing and unnecessary deaths, we can probably start to reduce restrictions. People can travel a little more freely, etc. It will become much more like influenza in terms of how we manage it. When they studied the efficacy of these viruses, they gave the trial doses to people, and they gave placebo doses to people, and they looked at did they get sick or not. They did not measure whether or not you could find the virus in people's noses. They just know that when I say that the Pfizer vaccine is 95+% effective, what I'm saying is they don't get sick. I don't know if in some percentage of those people, if you swab them, would you be able to find coronavirus in their nose. People may be carrying it around and not getting sick and still able to spread. I suspect that that won't be the case. I suspect it'll be pretty rare that somebody who's been vaccinated can spread it. But I don't know that for sure. And until we do know that, the mask wearing and the social distancing is important. At the same time, I'm a firm believer that different rules for different people are dangerous. If a simple statement, well, I've been vaccinated, I don't need to wear this mask, in the short term is probably likely to hurt us because I expect it would be abused, and would encourage people to be a little bit more lackadaisical. We'll get to a point where we can do that, but we're definitely not there yet, and there are not enough vaccines out there yet. I think this is worth understanding because there are a lot of people that are afraid of this, new vaccine and what does it mean, and some of the terms they use are a little bit scary. So the Pfizer and the Moderna vaccine are what's called mRNA vaccines, and what that means is when the Chinese described this new virus back in 2019. They sequenced the RNA in that virus and said, yes, we can confirm this is not something we've seen in humans before. And the way a virus works is it has RNA or DNA in it, and it injects that into your cells, and then your cells start making more of that virus. This happens every time you get a cold or any kind of virus. that virus replicates and you get sick and you fight it off, but presumably you spread it to someone else, and that's how viruses move around. In this case, what Pfizer and Moderna have done is they have taken a form of that RNA. It's mRNA, it's messenger RNA, and that's basically a way to instruct the cell to do something, and it instructs the cell to make part of the virus. It's called the spike protein. And so Pfizer and Moderna inject that mRNA into your shoulder, and the cells of your deltoid muscle starts making spike protein because it's got that instruction book now. It's not making the whole virus. You don't have the whole virus in you. You cannot get COVID from the vaccine. It's just making part of it. But your immune system doesn't know it's only part of it, and it reacts to that. It recognizes it as foreign and starts to fight it off. And it works really, really well because you can get a pretty massive response out of that. It's also a much cleaner way and faster way to do it. In order to make a spike protein virus with traditional vaccine technology, you might have had to grow the virus in eggs, which takes time, and then clean that to get the spike protein off of the virus and get rid of the rest of the virus, process it, put it in a vaccine, and then inject the spike proteins into somebody. Now all they have to do is inject that messenger RNA, and your body starts making it. They're basically hijacking the virus's own mechanism and using it against it. You don't have to grow it in eggs. You can do this a lot faster. This is relatively old technology. Sequencing of DNA and RNA is an old thing. They've been talking about genome projects and such for decades. The problem to this point with messenger RNA and vaccines is it's a very unstable. When you create this in a lab, it falls apart quickly. So you can make it, and that's great, but actually getting it into somebody has been kind of a neat trick. Part of Pfizer's solution to that was the hypercold, so it is stored in freezers that are roughly negative 90 degrees Fahrenheit, which is logistically a challenge. Moderna has figured out how to stabilize it a little bit better, and in the long term, Moderna's techniques will probably be utilized. But because it's just the mRNA, there's actually very little in this vaccine. There's some fats in there that encase the mRNA and allow it to kind of slip into your cells. There are some salts in there to make sure that it is the correct salinity so that it matches your body. There are some sugars in there so that it is stable when it is frozen. And that is about it. There are not preservatives, there's no egg products, there's nothing else. And so it is very clean, it is quick to make, and now that we know how to get it into people, it's a pretty great vaccine. Functionally, the Pfizer and Moderna vaccines are pretty much the same. There's very little difference between them. And then in terms of that and the ones coming down the pipe, the other vaccines, such as the Johnson & Johnson vaccine, is more traditional. I'm not sure what exact process that they utilized, but these two are a new technology in the sense that we figured out how to use it, not that we didn't know how to make mRNA in the past. In terms of safety of the vaccine, anytime you put anything in your body, there's always the risk of allergy. That applies to foods. So of course that's true for this vaccine because you're putting it in your body. Thus far, Pfizer has reported, and the federal government has reported, 6 serious allergies with the Pfizer vaccine out of 250,000 doses. And so it's a real risk, but it's really, really low. You take a much bigger risk when you get in your car every morning. But it's something to be aware of, and when we administer it, we're careful about that. We watch people, and we have appropriate medications to address an allergy, such as EpiPens and such. Beyond that, there's really no reason to expect other significant effects that would be unusual. Um, Many vaccines have a theoretical risk of your immune system going a little bit haywire and an autoimmune effect. Guillain-Barré is an example of that, where your immune system misrecognizes the vaccine and starts attacking your own immune system. Historically, those numbers are 1 in a million, 1.5 million. So also incredibly low risk, but it's real. I would expect these vaccines to be somewhere along the lines of that, but there's nothing else really in them, and so there's no reason to expect other problems. It's a little bit along the lines of if you were to buy a new car. You cannot say for certain that running down the highway the brakes are not going to go out. But you have no reason to expect that, and so you don't worry about it. There's really not much in this vaccine. And all it does is make this spike protein, which is just part of the coronavirus. And that's what your immune system needs to recognize and fight off a real coronavirus infection. So I had, well, actually, I was impressed. The shot itself was so tiny. I wondered if I couldn't maybe even sleep through it. I think I probably could have. I barely knew anything was going on. My shoulder was sore the next day, similar to any other vaccine, flu vaccine or what have you. That settled down fairly quickly, and that's been it for me. The other staff that have had the vaccine have reported very similar effects. We did have one staff member, it triggered a migraine, and that's been about the extent of what we've seen here at Gifford. I expect the booster to be a little bit more significant. So right now, my body is making this spike protein, and it's learning that this is a theoretical problem because it's foreign, and my immune system is learning how to fight it off. And when I get the booster, my shoulder is going to start making a lot more spike protein, and my body is going to assume that I'm under attack with coronavirus, and it's going to do all the things that happen when you get sick, fevers and body aches and so on and so forth. You're not really sick, it's just the spike protein, so it doesn't last very long. But I wouldn't be surprised if I'm wiped out for a day or two. I'm scheduled for that dose on the 8th. So the Pfizer booster is 3 weeks and Moderna is 4 weeks. This is an amazing technology and a pretty significant scientific advancement. The fact that they've figured out how to do this with a vaccine, get the mRNA into a stable product they can get into people, is going to revolutionize the technology. In the future, we're going to be able to get vaccines quickly on the regular. All you've got to do is sequence the DNA or RNA. I would not be surprised if they didn't go back and redo a lot of our older vaccines because it is so efficacious that we can use some of this technology to make old vaccines work even better. So we will be better equipped to eliminate some diseases that we're already vaccinating against.